Each part, you will hear a number of different extracts. At the beginning of the test, you will hear a beep sound. You will have time to read the questions before you hear the extracts. You will hear each extract once only. You have to complete your answers as you listen. At the end of each test, you will be given 2 minutes to check your answers. Part A. In this part of the test, you will hear 2 different extracts. In each extract, a healthcare professional is talking to his patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for extract 1. Extract 1. Questions 1 to 12.
Hello, doctor. Good morning.
Good morning. May I find out what the problem is?
I've been experiencing the symptoms of heart failure for the past year, doctor. Although it appears okay in general, I feel a lot of stress and fatigue. I've also noticed shortness of breath with exertion. I am getting attacks of severe shortness of breath and coughing that usually occurs while I'm sleeping. I have developed edema and had a mild leg swelling a while ago.
Do you have severe chest pain called angina, palpitations, or syncope?
No, doctor, but I feel some irregularity in my pulse. Over the past 10 months, these symptoms have been gradually worsening. Over the past year, I've gained about 20 kilograms in weight, doctor.
What's your age?
63, doctor.
Have you had any previous illnesses?
I had right inguinal hernia surgery 7 years ago. I had trauma to my right thumb.
Do you have diabetes, mellitus, or heart murmur?
No, doctor.
Do you smoke or drink?
I don't smoke, but I drink.
Tell me about your family history. Any illness?
My mother's alive at 92. My father died at 76 of a heart attack.
Are you taking any medications?
Yes, doctor. Aspirin, 81 milligrams daily, and chlordiazepoxide and clidinium combination pill at 5 milligrams or 2.5 milligrams, 1 tablet daily for stress.
Are you allergic to any medicines?
No, doctor.
Okay, well, according to my comprehensive cardiovascular examination, your blood pressure is 120/70 in each arm seated. Your pulse is 80 beats per minute and regular. Your breathing is 2 times per minute, and that is unlabored. Lungs are clear to auscultation and percussion. The first and second heart sounds are normal. You have a fourth heart sound and a soft systolic murmur. The precordial impulse is enlarged. Your electrocardiogram shows sinus rhythm with left ventricle hypertrophy. Your peak oxygen consumption was 19.7 milliliters per kilogram of body mass per minute, which is consistent with mild cardiopulmonary disease. Laboratory data shows your thyroid stimulating hormone 1.33. Your glucose is 97 and creatine 0.9. Potassium is 4.3. I reviewed your echocardiogram thoroughly. That shows a dilated cardiomyopathy with ejection fraction of 15%. Your post-stress ejection fraction is 33%, and left ventricular cavity appears enlarged. This appears to be a newly diagnosed dilated cardiomyopathy of uncertain etiology and dyslipidemia. I'm going to prescribe angiotensin converting enzyme inhibitor lisinopril 2.5 milligrams daily and a beta blocker carvedilol 3.125 milligrams twice daily. In addition, you could benefit from a loop diuretic, furosemide 20 milligram daily. I don't think you need a defibrillator right now, and after 3 months of medication, I want you to go on an echocardiogram. If your left ventricular function has not improved, then you would benefit from a prophylactic use of an implantable cardioverter defibrillator. So continue with these medications and meet me after a period of 3 months.
Thank you, doctor.
Extract 2. Questions 13 to 24.
Hello, good morning, doctor.
Good morning. Tell me, what's your problem?
Well, I have a history of first-degree atrioventricular block and had a pacemaker placement. I feel this problem of decreased eye vision. Last time the problem lasted for about 5 minutes. That occurred 4 weeks ago when I was driving the car.
Then how did you manage to drive?
Well, I was able to pull the car over to the side of the road without much trouble. During that time, I felt nauseated and lightheaded. When I approached the clinic at that time and received a CT scan, carotid Dopplers, echocardiogram, and neurological evaluation, all of which were unremarkable. I couldn't have an MRI due to the pacemaker placement.
Okay. Did that occur again?
No, doctor.
Any lesions or change in vision, headaches, change in gait, or other neurological issues?
No, doctor.
Do you have any back pain, bowel or bladder incontinence, or frank lower extremity weakness?
No, doctor.
What's your age?
57, doctor.
Do you drink or smoke?
I don't smoke, but I drink alcohol, only on some special occasions.
Any past illness or surgeries?
I had pacemaker placement for atrioventricular block, and I had bilateral knee replacement 3 years ago and have some pain in my knees.
What medications are you taking?
I have recently started on Plavix, suggested by primary care doctor. Other than that, baby aspirin, 81 milligrams per day, Proscar, 5 milligrams, GD, and Synthroid, 0.2 milligrams daily.
Are you allergic to any medication?
No, doctor.
Well, your physical examination shows your blood pressure at 134/80, your heart rate 60, respiratory rate 16, and weight is 244 pounds. Cranial nerves 2 through 12 are intact, and you have normal bulk and tone throughout. There's no cogwheeling. There is some minimal weakness at the R4 plus or 5, and possibly trace weakness at the quadriceps -5 or 5. You have decreased sensation to vibration and proprioception and vibration. There is no dysmetria or tremor noted. His Romberg is negative. You have developed transient ischemic attack. The character of his brief episode of visual loss is concerning for compromise of the posterior circulation. Differential diagnosis include hyperprofusion, stenosis, and dissection. You have lumbar stenosis. The symptoms are very mild and consist mainly of some mild proximal upper extremity weakness and very mild gait instability. You have to get a CT angiogram to evaluate the integrity of the cerebrovascular system.
This is the end of Part A. Now, look at Part B. Part B. In this part of the test, you will hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare environment. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You will have time to read each question before you listen. Complete the answers as you listen to the audio. Now, look at the question 25.
Doctor, can you explain to me whether measuring serum amylase or serum lipase is significant for acute pancreatitis?
Well, measuring both serum lipase and serum amylase is not necessary. Measuring serum lipase alone is adequate for diagnosing acute pancreatitis, since it is more effective than serum amylase, especially because it rises more quickly and remains elevated longer. According to a study of 151 patients with acute pancreatitis, the sensitivity of lipase was about 97% and the specificity was almost 100%. Contrarily, the sensitivity of amylase was just 79% and the specificity was 99%. Therefore, amylase should be replaced by lipase as the first-line laboratory investigation for suspected acute pancreatitis.
Question 26.
Hello, doctor. What are uterine fibroids?
Well, uterine fibroids are benign tumors that may grow in various parts of the uterus of a woman. Intramural fibroids are the most common type of fibroid that appear within the muscular wall of the uterus. Intramural fibroids can grow larger and stretch the womb. Subserosal fibroids form on the outside of the uterus called the serosa, and may grow large enough to make the womb appear bigger on one side. Submucosal fibroids bulge into the uterine cavity. Pedunculated fibroids are attached to the uterine wall by a stalk-like growth called a peduncle, which is the main difference between pedunculated fibroids and other fibroids. If a pedunculated fibroid forms in the middle muscle layer or myometrium of the uterus, then it is called pedunculated submucosal fibroid. And if it forms outside the uterus, it is called a pedunculated subserosal fibroid.
Question 27.
Thimerosal is a mercury-based preservative that has been used for many decades in the U.S. in multi-dose vials of medicines and vaccines. There is no significant evidence of side effects caused by the mild doses of thimerosal in vaccines, except for minor reactions such as redness and swelling at the injected site. However, during 1999, the Public Health Service agencies, the American Academy of Pediatrics, and vaccine manufacturers agreed to reduce or eliminate thimerosal usage in vaccines as a precautionary measure. Methylmercury is obtained from certain kinds of fish. A high exposure to methylmercury can be toxic to people. However, over a lifetime, everybody is exposed to some methylmercury. Thimerosal contains ethyl mercury, which is the most widely used form of organic mercury that is cleared from our body more quickly than methylmercury and is likely to cause any harm to the individuals.
Question 28.
Hello, doctor. Can you explain to me what is leukopenia disease?
Well, leukopenia is a condition where the patient has lesser white blood cells in their bloodstream, which is diagnosed with a blood test called a complete blood count. There are 5 types of white blood cells, and each of them protects the body from a different kind of infection. Neutrophils make up 55 to 70% of total white blood cells, and they fight off fungal and bacterial infections. Lymphocytes protect the body from viral infections. Monocytes are the largest of the white blood cells, and they fight against bacteria, fungi, and viruses. And they mend tissue damaged by inflammation. Basophils are involved in inflammatory reactions to allergens. Eosinophils fight parasites and play a role in allergic reactions and conditions, such as asthma.
Question 29.
Hello, doctor. What should parents do as peanuts have become an allergic substance nowadays?
It is really a very frightening factor to know that peanuts can cause allergic reactions, with increasing reports of sudden death in children following peanut ingestion, and new products are being launched on the market to help parents stave off a peanut allergy in their children. What I feel is feeding peanuts to children doesn't require any specialized products. Right now, we have the strongest evidence that kids are at high risk because they have a severe egg allergy or eczema, and the dietary guidelines suggest that infants with severe egg allergies or eczema should intake peanuts as early as their 6th month. What I feel is introducing peanuts to infants with moderate or mild eczema or egg allergies in a developmentally and culturally appropriate method would probably help prevent peanut allergies for the rest of their lifetime. Since peanut allergies are increasing rapidly, the early feeding strategy is something that the parents should consult with their pediatrician, as it is one of the best sources of protein.
Question 30.
The bony growths that develop on the finger joints are called Heberden's nodes, or interphalangeal joints. Mostly, Heberden's nodes develop on the joints nearest to the fingertips, causing the fingers to appear crooked. They only develop in osteoarthritis patients. Each joint in our body has a layer of cartilage to protect the bones. Osteoarthritis causes the cartilage layer to degrade, gradually allowing the bones in the joints contact directly with each other. Over time, the bones get damaged from scraping together. Our body reacts to this body damage by developing new bones that are known as nodes. Heberden's nodes are one of such bone formations on the fingers of patients with severe osteoarthritis.
This is the end of Part B. Now, look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about specific aspects of their work. For questions 31 to 42, choose the answer, A, B, or C, which best fits according to what you hear. Complete the answers as you listen to the audio. Now, look at Extract 1. Extract 1, for questions 31 to 36.
Extracting blood or blood components products from one individual and inserting them into the circulatory system of another individual is known as blood transfusion. Therefore, the blood transfusion can also be considered a form of organ transplant. Generally, it is performed as a treatment for different medical conditions, such as massive blood loss due to surgery, trauma, shock, and other conditions in which the body tissues are not oxygenated adequately. Where carbon dioxide or other toxic materials are not effectively removed, and where the red cell producing mechanism fails. Great care should be exercised during a blood transfusion to make sure that the recipient's immune system is compatible with the transfused blood, and also that the donor's immune system is compatible with the recipient's immune system. Moreover, blood type classifications A, B, AB, and O, and the rhesus factor classification, positive or negative, should be verified. Nowadays, a number of tissue type factors are also considered to determine histocompatibility. These tissue type factors become increasingly crucial in patients who receive many blood transfusions, as their bodies have to develop increasing resistance to the transfused blood. Depending on the needs of the community, at the time only parts of the blood are taken for transfusion. Blood is composed of red blood cells, platelets, and plasma. The platelets and plasma can be donated separately in a process called apheresis. In this process, blood is separated into components after being extracted from the donor. For instance, albumin protein is transfused for treating burns, and platelets used for treating hemophilia, cryoprecipitate, and immunoglobulin antibodies are transfused for treating immunological disorders. There will not be transfusion-related risk factors for the blood donor while transfusing the whole blood, besides the minute chance of infection or injury to the site. However, this is a certain risk to the donor when he donates plasma and has red blood cells reinfused. However, this risk is preventable by following appropriate sterilization procedures. Significantly, It has caused severe public health hazards in China, where they were often unregulated. The plasma collection centers of the U.S. are the best known examples of safe apheresis donation, which is maintained by pharmaceutical companies, involving paid donors up to twice a week. Interestingly, veterinarians occasionally perform blood transfusions to animals. Different species require different levels of testing to ensure a compatible match. Cattle have 11 blood types. Cats have 3 blood types. Dogs have 12 types of blood. Pigs have 16 types, and horses have 34 types of blood. The experimental and very rare practice of interspecies blood transfusions is known as a form of xenograft.
Now look at extract 2. Questions 37 to 42.
Guidelines for the early detection of cancer. I am going to explain to you the guidelines for screening different types of cancers. These screening tests are suggested to detect cancer before the patient develops any symptoms. Colon and rectal cancer and polyps. Starting regular screening at the age of 45 is suggested for people at average risk of colorectal cancer. The screening can be performed either with a sensitive test that examines for cancer signs in the stool of the person or with an exam to look at the colon and rectum. This can be done either with a sensitive test that looks for signs of cancer in a person's stool or with an exam that looks at the colon and rectum. If the person is maintaining a good health, he should continue with regular screening through to the age of 75. For people aged 76 to 85, they should confirm with the physician whether continuing with the screening is right or not. People above 85 should no longer get colorectal cancer screenings. If the person wishes to be screened with a test other than a colonoscopy, any abnormal result should be followed up with a colonoscopy. Cervical cancer. Cervical cancer screening should begin at age 21. However, women below 21 years should not be screened. Women between 21 to 29 should have a Pap screening done once in every 3 years. However, HPV screening should not be performed for this age group unless it is required after an abnormal Pap test result. Women between 30 to 65 should have a Pap test in addition to HPV test termed as co-testing done every 5 years. This is the most suggested approach. However, having a Pap test alone is also okay for this age group. Women above 65 who have had regular cervical cancer screening for the past 10 years with normal results should not be tested for cervical cancer. Once screening is discontinued, it should not be started again. Women with a history of severe cervical precancer should continue screening for at least 20 years after that diagnosis, even if testing goes past age 65. The women whose uterus and cervix have been removed, total hysterectomy, for reasons not related to cervical cancer and without any cervical cancer history or severe precancer should not be screened. Women vaccinated against HPV should still follow the screening recommendations for their age groups. Women with a history of HIV infection, organ transplant, DES exposure, etc. may require a different screening schedule for cervical cancer. Breast cancer. Women from 40 to 44 should have the choice to start annual breast cancer screening with mammograms. Women from 45 to 54 should get yearly mammograms. Women above 55 may get mammograms once in every 2 years. Screening should continue as long as a woman is in good health and is expected to live more than 10 years. Women should be well informed with the known benefits, potential harms, and limitations linked to breast cancer screening. Certain women with a genetic tendency, family history, or certain other factors should get screened with MRIs along with mammograms. Endometrial cancer. I would recommend that during menopause, every woman should be informed about the risks and symptoms of endometrial cancer. Certain women with a disease history may need to opt for a yearly endometrial biopsy. Lung cancer. I would recommend yearly lung cancer screening with a low-dose CT scan for certain people prone to lung cancer who meet the following criteria: aged between 55 to 74 years and maintaining good health, and stopped smoking in the past 15 years, and having a minimum of 30 packs per year smoking history. Prostate cancer. I would recommend that men make an informed decision after consulting with a physician whether to be screened for prostate cancer. Research has not yet proven that the benefits of screening outweigh the harms of testing and treatment. Therefore, I believe that men should not be screened without understanding about the risk factors and benefits of screening and treatment. Starting from the age of 50, men should consult a physician about the risk factors and benefits of screening so that they can decide if screening is right for them or not. If they are African American or have a father or brother who had prostate cancer before the age of 65, one should consult a physician right from the age of 45. If one decides to be screened, he should get a prostate-specific antigen blood test with or without a rectal exam. How often he will be tested will depend on his prostate-specific antigen level.